Okay, welcome back guys. Here again is Upstream Health with Ife. In this video, I'm going to quickly teach you guys how to do the deep breathing exercise, also called the belly breathing exercise or the diaphragmatic breathing exercise, or you can also see it as taking long deep breathing. That way air fills your lungs expands better, and your lungs or your body is in connection with your brain. And that's why research has shown that when you take deep breathing exercise, it can regulate your parasympathetic nervous system. That way it can bring down your breathing, it can bring down your blood pressure, it can help you with relaxing and opening up your lungs, especially if you have like COPD, asthma. It can help you achieve a relaxed mood in situations of panic, anxiety, and stress. So let's go. So if you want to do this deep breathing exercise, by the way, there are so many breathing exercises. There are like 4 or 5 of them, but I'm going to be teaching you people the deep breathing exercise. There's also the box breathing exercise. I use those two most of the time, but here I'll teach you guys the deep breathing exercise. Will help you bring down your blood pressure, your heart rate, and calm anxiety and stress. So if you want to do this, the best position to take is either laying on your back, all right, with arms and legs relaxed, not crossed. The second position is sitting this way with your legs flat on the floor. Most of the time, if you're in a private area, you can take off your shoes and make sure your feet are touching the floor. All right, but you can put on your shoes if you like, but most of the time take off your shoes and relax this way. Make sure you're relaxed, okay? No tensed muscles. All right, so you put your foot flat on the floor and you relax. Take normal breathing, like usually you breathe in, out. But here, for the deep breathing exercises, you're gonna be breathing in through your nostrils, through the nose, and you're gonna breathe out through your mouth. So it's done this way. You breathe in through your mouth, through your nose, in a stretch of 3 to 5 seconds. You breathe it like 3 to 5 seconds, and then you hold it. So 3 to 5 seconds. You hold it there again for like 3 seconds or 5 seconds, depending on how much you can go. So if you're new, you can start with 3 seconds because it makes some people dizzy or lightheaded. And if you feel lightheaded or dizzy when you do this, I advise you stop. So you breathe in 3 to 5 seconds. You hold it up there again for 3 to 5 seconds, and then you puff, like breathe out through your mouth again, 3 to 5 seconds. You hold it there 3 to 5 seconds, and then you breathe it. So let's do that. Usually it's called belly breathing, which means your shoulders shouldn't be involved, or the muscles of your shoulders shouldn't be involved. It should be your belly. So you're gonna see your belly rising when you're doing this. So usually you can put your hands here people put their hands in here to make sure that they're using the belly, but I already know I'm using this. So if you're doing it for the first time when you breathe in, so let's go. Breathing through your nostrils, your nose. Out. In. Hold it there 3 to 5 seconds. Out. Hold it there. In through the nostrils. Out. In. So when you do this, you can do it like 5 to 8 times every hour. So you can do this in a waiting area, in the subway, while you're relaxed on the bed. So you can do this anywhere and nobody is gonna know you're even doing it. So it's very, very relaxing and calming. You can do it while you're sitting in a waiting area, like I said, in a subway, on the plane, when you're about to see your primary care provider, like if you're anxious about to know results, you can do that and that will distract you and also notify your parasympathetic nervous system to take care of things, to calm things down, reduce your heart rate, and reduce blood pressure. So make sure you're doing this at least. This is not only for those who have high blood pressure. Anyone can do this as long as you don't have a structural heart disease. So, but find out from your primary care provider if this is a healthy behavior for you. So very important that when you're doing this, you are sensing how your body is responding. Like I said, some people may feel dizzy or lightheaded. If you feel that, you stop right away. But this will help you with your blood pressure, with your heart rate, with anxiety, a racing heartbeat, stress. This you can do when you're having panic attacks or anxiety. So another option, like I said, is when you're having a racing heart rate, is you can dip your face in a bowl of chill water, very cold water. When you dip your face in a bowl of cold water, that can calm your heart rate down. That can put your parasympathetic nervous system at work and reduce your heart rate. So if you have any question, you can also ask me that question in my Instagram page, and I hope you enjoyed it. So you can always do this, like if you have high blood pressure, you can check your high blood pressure before you do this, and after doing this like 5 or 10 reps, you can check your blood pressure again and see that your blood pressure and heart rate would have dropped. Okay, and make this a daily healthy habit. Stay blessed.